Good day. I'm Josiah Paolo Mutia, here to present my paper on the correlation of modified Frailty Index and Charlson Comorbidity Index with clinical outcomes based on the Western Ontario and McMaster University's Osteoarthritis Index in patients with femoral neck fractures treated with total hip arthroplasty in the Philippine Orthopedic Center. Total joint replacement has been shown to improve the quality of life in patients in several aspects. Total hip replacement improves function and relieve pain in patients who had hip pathologies. Over 300,000 procedures are done per year worldwide, with 200 to 300 cases done per year at our institution. Assessment of outcomes after total hip arthroplasty come in different forms. The Western Ontario and McMaster University's Osteoarthritis Index is a joint-specific patient-reported outcome measure that has 24 questions covering pain, stiffness, and dysfunction. In a local study assessing a Filipino version of WOMAC in evaluating patients with femoral neck fractures treated with hemiarthroplasty, the outcome measure was found to be reliable, valid, and responsive. Comorbidities are diseases or clinical entities that are unrelated to the etiology of the principal diagnosis. These are important to identify because these circumstances may alter the proper diagnosis, treatment, and prognosis. They were found to be related to mortalities and implant survivorship in hip arthroplasties, but there are no concrete correlation between comorbidities and functional outcomes. Charlson Comorbidity Index was developed as a method to classify comorbidities. Worsening CCI were related to worsening WOMAC in total knee arthroplasties. Frailty, on the other hand, is the decreased physiologic reserve usually coming with the progression of age. The modified Frailty Index is a measure of frailty that has been shown to be predictive of several clinical outcomes, but has not been correlated to specific functional outcomes yet. This study aims to show the correlation between comorbidities and frailty with functional outcomes in patients with femoral neck fractures treated with total hip arthroplasty at 3, 6, and 12 months post-op. This is a case series done in the Philippine Orthopedic Center from January 2019 to December 2021. A final count of 47 patients with femoral neck fractures were included. Preoperatively, demographic data, ASA, pre-injury WOMAC, CCI, and MFI were collected by the primary investigator. WOMAC scores were again collected at 3, 6, and 12 months post-op. The cases included all adults with isolated femoral neck fractures treated with total hip arthroplasty. Excluded from the study are those with previous hip pathologies or surgeries, non-ambulatory patients, and those that cannot understand Filipino or English. The following were the statistics used in the study. The patients included were aged 22 to 91, with an average age of 66. The patient profile was largely made up of females at 83%, and the average time to surgery was 71 days. In general, WOMAC was shown to be decreasing as the months of follow-up progressed. Correlation of comorbidities through Charlson Comorbidity Index and functional outcome through WOMAC showed non-significant correlation. This is also true with frailty through modified Frailty Index and WOMAC, showing non-significant correlation. The American Society of Anesthesiologists, or ASA score, was shown to have significant linear correlation with functional outcome at 3, 6, and 12 months post-op. In conclusion, CCI and MFI, as measures of comorbidities and frailty respectively, have weak correlation to WOMAC as a measure of functional outcome for patients with femoral neck fractures treated with total hip arthroplasty. As such, these measures of comorbidities and frailty may provide some clinical value in terms of patient education and case discussions. However, further investigations in a larger scale may be warranted before these parameters can be recommended to be part of a treatment algorithm for femoral neck fractures. While ASA scores remain as a useful, significant preoperative clinical factor in relation to postoperative functional outcome in patients with femoral neck fractures treated with total hip arthroplasty, this reinforces the prognostic value of ASA score in our clinical practice in terms of orthopedic clinical outcomes. The following are my references. Thank you.